Let's talk about hemophilia and von Willebrand's disease. Think of hemo as blood and philia as love. For hemophilia, they love to bleed. It is an inherited condition. Hemostasis is impaired. Let's do some revision of coagulation process. After a cut or damage to the endothelium, inner lining of blood vessel, there is immediate vasoconstriction, which limits the amount of blood flow. Afterwards, platelets adhere to the damaged vessel wall. This recruits additional platelets to form a plug. This is primary hemostasis. Afterwards, coagulation cascade is activated. Clotting factors come to the scene, including fibrin, to form a mesh on the platelets. This forms a hard clot on the site of injury. This is secondary hemostasis. In hemophilia, there can be deficiency in clotting factors 8. This is called Hemophilia A, classic hemophilia, or a deficiency in clotting factor 9. This is called Hemophilia B, Christmas disease. Remember, in von Willebrand's disease, there is lack of von Willebrand's factor, VWF. Von Willebrand's factor is a carrier protein for factor 8. For von Willebrand's disease, factor 8 gets broken down faster and can become deficient too. So that's why in von Willebrand's disease, there is bleeding issue. Let's go back to hemophilia. Hemophilia can be acquired, no genetic link. NCLEX does not ask of this, but remember these about acquired hemophilia. Some causes. 1. Liver failure. Remember, liver synthesize factors 1, 2, 5, 7, 8, 9, 10, 11, 12. 2. VTK deficiency. VitK is needed by the liver to synthesize some of these clotting factors. 3. Autoimmunity. 4. Disseminated intravascular coagulation, DIC. This can consume coagulation factors. In hemophilia, the muted genes are found on the X chromosome. So, hemophilia is a sex-linked recessive, meaning it largely affects males since males have only one X chromosome. So generally, women are carriers and are mostly asymptomatic. Sign and symptoms of hemophilia. Note that it is all about bleeding. Think of 1. Easily bruising, ecchymosis. 2. Hematuria. 3. Prolonged bleeding. 4. GI bleeding. 5. Epistaxis. 6. Bleeding in joint spaces, hemarthrosis. 7. Bleeding in brain, deadly. Put patient at risk of increased ICP and stroke. That's why neurological assessment is important in hemophilia patients. You can think of bleeding issue for von Willebrand's disease as well. Diagnostic finding 1. Platelets, usually normal. 2. Prothrombin time, PT. It tests for the extrinsic and common pathway. Simply put, it assesses factors 7, 5, 2, prothrombin, 1, fibrinogen. So, remember this. Prothrombin is normal in hemophilia 3. Partial thromboplastin time, activated PTT, PTT, or APT. This is a more appropriate test, since in check for the intrinsic pathway, that is factor 12, 11, 9, 8, 10, 5, 1. So, in hemophilia, APTT/PTT will be prolonged. Treatment/management 1. Desmopressin, DDAVP. For mild Z8 deficiency, desmopressins stimulate von Willebrand's factor from endothelial cells, which promote the stability of factor 8 and can also help increase the factor. 2. General treatment is aimed at replacing missing clotting factors 3. Hemophilia patient with joint pain. Report to HCP 4. Altered mental state? Report to HCP 5. Joint bleeding. Do the following. Immobilize, elevate, apply ice. For superficial bleeding, apply direct pressure. Patient teaching. Avoid contact sports. Wear protective helmets, elbow and knee pads when cycling. No NSAIDs. No dental flossing. Minimized or avoid IM medication. Minimize venipuncture. Use soft brittle brush. Patient environment should be cluster-free. No cords on floor, no throw rugs, etc. Teach patient to use electric razor, not a straight razor. Prevent constipation. In summary, institute bleeding precaution. Von Willebrand's disease interventions are similar to hemophilia. all about bleeding, please kindly like and subscribe to our channel. NCLEX is achievable.